Welcome back to my YouTube channel. This is AJ Show, and the program that we have on air is Story Time. So, guys, this is all about entertainment.
Hey guys, welcome back to my channel. This is AJ Show, and the program that we have on air is Story Time. So, guys, today I have a guest, and we want to talk about a very disturbing topic. It's a topic on mental health. And guys, as you all know that mental health has always been a topic of discussion, and the final resolution has never come to light. So today we have none other than Derrick. He will enlighten us on the topic that we have today. So welcome.
Thank you very much for this opportunity. To the viewers, I welcome you to view the channel, support the channel. So today, the topic of discussion is mental health. And when we talk of mental health, it contains several things. Mental health encompasses your psychology, your ability to control your emotions, anything pertaining to emotions, abilities, your memory, all those actually pertain to mental health. So when you talk of mental health, there are some of the disorders. So these disorders simply interfere with the physiological functions of your mental system. So these disorders, there are several. We have depressive disorders as a result of depression. For example, you may have a maniac, you may have other depressive disorders. Another one, we have psychotic disorders, that is schizophrenia. Then also we have another one that is called anxiety disorders. So these anxiety disorders, for example, when you are in a state of panic. So in any situation, maybe one or two, you are in an event, for example, maybe an exam, then just panic comes in. That one is, we classify it as anxiety disorder. So these disorders actually comes about due to various issues. One, there is something we call genetic predisposition. So if maybe your family lineage, there is the history of depression or maybe anxiety disorders, so it may be followed from one actually generation to another. Then number two is actually lack of sleep or just inadequate sleep. Human beings, normal human beings, should actually sleep 6 hours. For younger ones, there are at least 6 hours. I think that is just the normal duration one is supposed to sleep. Then when actually you limit this time, nowadays, because we are in a digital generation, most of us tend to spend much of our time in digital gadgets, and majorly we actually realize that it is past midnight. We have not gone to rest or sleep. So this little time, so you realize you sleep for 1 or 2 hours, you wake up in the morning, you go to your day-to-day activities, so you actually slept for 1 or 2 hours. So this inadequate sleep actually risk a person to these mental disorders. So another cause can be due to maybe trauma, when you actually get an accident, or maybe you have like somehow brain damage. So this one can actually predispose one to these depressive disorders. So you may ask yourself, what are some of the examples? Because these disorders actually you may have them and you don't know. For example, when you talk of a depressive disorder, when someone is in depression, actually, first of all, the thoughts of that person actually becomes very low. You stop thinking, even the things you know becomes just unfamiliar to you. You are in a state of low moods. Then also activities, you tend to actually be slowly in doing activities. Just I can say mwendo wa kobe. So another maybe disorder that is related to depression, that is maniac. So when we talk of maniac, this is another depressive disorder. And this actually, when you are in this maniac state, the person in this maniac state actually tends to be more agitative, as in they tend to be more harsh on small issues, maybe issues of disagreement. They actually are ready for anything, any war, anytime. Their thoughts, they have what we call flight thoughts. So they think very fast, and also they see themselves as people who can actually do 10 things at a time. We have music there, we have cooking there, anything there, you are doing them at once. And actually you see yourself that you can do extraordinary things that actually normal people cannot do. Those are some of the just few examples. So you may be out there going through those issues unawarely, but just know there's some of those symptoms of depression, and also some of the behaviors of a person who are depressed actually be like. Then you may be asking yourself, now you've known depression, you've known depressive disorders, other mental health issues. Then you ask yourself, now I have these issues, now what next? What next? When this problem has not reached this actually extreme state, because when depression reaches an extreme state, you develop suicidal thoughts, and you see yourself as having a meaningless life. So when you realize, or maybe people closer to you realizes this earlier, what are some of the few steps that you can take? You can decide to see a psychiatrist for maybe counseling. Then maybe you can undergo therapy. There is medications, antidepressants. Even though when you take these antidepressants, they have some things we call side effects. So side effects can sometimes exacerbate these symptoms or maybe relieve. So you need to understand that, or a person close to these people, you need to understand that sometimes it's due to side effects of these drugs, that maybe the patients or the person suffering from these depressive disorders can be more agitative. So apart from medication and maybe seeking therapy, as a normal person, maybe you are in a stress-related state. You know, stress also interfere with the mental health. So what are some of the tips that you can use to actually get through depression? Number one is regular exercise. So when you do exercise, actually your brain comes into active state. And when it is in this active state, uh, the rate of blood supply and also oxygen nourishing the brain will be at a constant rate that will be enough for the brain to maintain its normal function. So when you do exercise regularly, these depressive disorders, you'll get through them. Number two is diet. When you talk of diet, you need to actually avoid more of these fatty foods. You actually need to know how to balance these diets, ensure that there is a balanced diet, and in one or two ways ensure that there is enough of the nutrients at par. Number three, you need to actually drink a lot of water. So water actually ensure that your body remains in that hydrated state, and therefore the volume of blood will remain at a constant rate. Then number three, you also need to have some few close friends that you can share with them your issues. You be a person who can who can share out the issues. You may be having one or two issues, but when you have that close friend, you need to have one or two close friends. You open up, and when you open up, actually, a problem that is communicated is half solved. So, when you talk to people, you actually you relieve of yourself that burden. Maybe you may be asking yourself, maybe this one or two of these my friends actually, and I lack trust in them. Look for one or two people that maybe you trust. They can be maybe your family members, your friends, relatives, anyone that is open to you. Air out your issues and actually ensure that open up as much as possible, because when you actually refuse to open up, this depression effect may build up, and actually you may see that there is no need actually of living, and that is where now the suicidal thought comes in. So actually look for one or two trustworthy friends that you can share with them. Then lastly, try to avoid being alone. When you are always alone, you actually tend to think somehow weird things, because you think of yourself, you judge them by yourself, and you want to do them by yourself. So when you are actually alone most of the time, you'll have to develop these issues of depression. So try to actually be with people, talk to people, talk to your friends, and ensure that your issues, you share them out. Thank you for listening. Thank you very much.
Dr.
Yes.
You talked of something about depression. Maybe someone out there is in the same situation, is battling depression in silence. What is that first step that the person ought to do? Ndio aendelee kuhili, so that he may move out of that problem to a safer place.
So when you find yourself in that depression state, maybe in one or two ways, there are some people that are close to you. You need to actually try and use those techniques that I've said. Number one, you can go and do a little bit of exercise, so that intense exercise can actually try to make your mind active. And so those thoughts which are running through your mind can actually be faded when you are in that process of exercise. Then also you can try to look for some of the possible ways. You can even decide to just tune in a music that will make your mind to be in a cute state. So you can choose that kind of music, you dance, so that you relieve of maybe the stress that you have. Then also you just ensure that you have enough water to ensure that your body is hydrated. So those are some of the immediate action you can take. But
And how? Okay, someone is there, and the person does not know that he or she is battling a mental health disorder.
yeah,
Yeah, and just how will someone know that, yeah, maybe this thing that I'm feeling or that is in me is a disorder and I ought to act on it?
okay. Actually, you are asking of some of the signs.
Yeah, prompting
Yeah.
things that will make you act.
Number one of this sign, when you just find yourself in a lonely state, that is, you don't want to associate with people. You find yourself just being alone most of the time. It is as a result of a depressive disorder. Then number two, you just actually find yourself in a state whereby you feel like you are in a low moment. That is as a result of mental illness. Maybe is a psychotic disorder, maybe, or maybe you have any other mental illness. So you find yourself in a lonely state, maybe an activity that you usually do daily, you find yourself that you don't have that energy to do that activity, or maybe if it is a hobby, habit, find you cannot now do it at your normal rate. So those few signs actually can indicate that you are suffering from depression or mental illness disorders.
And should you take the first step of going to the daktari, or there's a different step before you just decide I'm going to the doctor to ask about my issue?
Okay, the decision now can actually depend on the person himself. He or she can decide to seek professional help, or maybe you can decide to use the home remedies. So those home remedies, like the ones I've said, exercise, water, diet, you can actually employ them and get through depressive disorders. Then when maybe someone chooses to maybe seek professional help, you can go and see a psychiatrist. Maybe they can go there, diagnose the disorder, and then you are taken under medications so that to actually reduce the depressive effect. So it's dependent on the victim.
So, Dr. as you're a counselor also.
Yes.
So, as a counselor, should someone come to you and tell you their issue? Like they should just, okay, what kind of, let's say, a platform, or rather, how will someone reach a counselor so that they may air their issue? Because maybe, okay, people fear projecting their voices, or rather projecting their issues to strangers or other people they don't really understand and they don't know. So how will someone relate with a counselor so that they get to resolve
So I'll answer that question in two ways. In using a phenomena of or just a situation whereby there is a sick person there and there is a doctor. So you know, the doctor cannot come to look for a patient in the house, but it is the patient who do the otherwise looking for the doctor. So, but issues that actually do arise is issues pertaining to trust. Yeah, because most of individuals, they fear that when they go there, share out their issues pertaining to issues of depression, their stories can be used as a story in court. Yeah, so this will actually demoralize them. But as counselors, when you share with us that kind of a story, it will remain just between me and you. And when you share out your issues, we shall ensure that we actually provide you with ways on how to cope with it. Then another issue, you can maybe talk to another person, then that other person take you to maybe a counselor if you are not aware of one or two, or maybe if you are aware of actually a professional counselor. And there are ethics guiding counseling services. And one of the ethical principles is privacy, confidentiality, and empathy. So privacy and confidentiality, as counselors, both peer and professional counselors, they always ensure that your information remain private and confidential. So in short, just the person having the problem can go to the counselor or psychiatrist. But if maybe a counselor is actually a close ally or maybe a close friend to that someone, you can actually see based on facial expression, bodily movement, behaviors, you can see that this person is having maybe depressive disorder, problem in one or two. Then there you can chip in to help. But that is just to an extreme case that happens that the counselor is next to the client. Yeah.
Okay, doctor, there is this situation
Yes.
where an individual is a victim, and then the person close to the victim is a doctor, a nurse, a counselor, but then there's that fear of, no, I can't tell my close relative about my situation. Maybe the person will assume, or maybe the person will assume, or the person will just brush you off because they just tell you, maybe those are just genetics, those are just generational things. So, as a medical practitioner, yes, how do we counter all these? What kind of, should the victim go to someone far away, or should the person seek your assistance?
Okay, we are in a society whereby there is perception, society's perception of these mental illnesses. Some are saying they are witches, sokari, then maybe you say clan is fighting against you, such kind of issues. But what needs to actually happen is we need to actually educate people on these issues pertaining to mental health affairs, and also ensure that we spread the information as much as possible to ensure that it reaches a wider group of people, so that at least they can begin to understand that issues of mental health, such as depression, anxiety disorders, they are not cases. Yeah. Then also there is a way whereby you can actually manage to get through these conditions, actually, when maybe you air them out, then you're told this, there is something going on with you, you are bewitched.
It's not mental health.
It's not mental health. Yeah, actually, there is one need to actually also have what you call spiritual conscience or a spiritual belief. You may be issues pertaining to maybe you are a Christian or a Muslim. That one also will help you develop the actually perception of these mental health issues. So when you have that actually conscience and the people surrounding you also have that conscience, so this will enable them to look for ways on how they can assist you. I think that answers your question.
Yeah, thank you. Thank you for availing yourself. Thank you for enlightening us on what we ought to do on this topic on mental health. Yes, and okay, something. Kabarak University has been holding a 1-week mental health activism.
Yes.
And I believe you're part of it.
Yeah.
So what are your aims? Like by the end of this campaign, we would have achieved this and this and this, and yeah, like that kind of drawing board that you have, we would have achieved this and this and this, and we've solved something.
So as you are aware, we've been having a mental health awareness week. It has actually been 2 weeks. The first week was for activism, then the second week was the practical part. So during the first week there was just activism through online media platforms. We are actually making people aware of these mental health issues, the disorders, the symptoms, how to know you are actually suffering from these disorders. So what triggered us to actually begin this? There were increased number of actually suicidal cases that happened previous months, and also at the end of last year we actually lost several students due to suicidal cases, depressive disorders. Some just hurt themselves because they developed depression. They refuse to share, or maybe they fear sharing, and as a result of that, when now depression actually increases in strength within you, so you'll now begin to feel lonely. You see that there is no importance of living in this world. You take the step of taking out your life. So several students that we lost actually made us to develop this idea, and now upon developing this idea with the Guidance and Counseling Department in partnership with the Kabarak Student Council, we liaised together and ensure that we facilitated this activity. So in terms of what we actually expected at the end of this event is to actually ensure that we enlighten our students, we give them that knowledge, and we also educate them on ways that they can know they are suffering from these mental illnesses or mental disorders. So mental illnesses affecting students. So that was the first aim of this activity. Then second aim was to actually ensure that through partnership with the Lion Africa organization, psychiatric organization from Nakuru, we actually provide healthcare services to our students, like there were cancer screening for ladies, both cervical and breast cancer. To men, there were prostate cancer. To those who are the age bracket of 50 years and above. Then there were HIV and STIs. Then there were also counseling services that were being offered. So these services actually benefited our students, and therefore when maybe one has those kind of other illnesses not pertaining to mental health, they actually gotten the help from the facility. Then also what we are also expecting, that after this event, after this health awareness talk and activism is over, we actually need to go back to the drawing board, ask ourselves, what are the benefits that we've realized? Are the cases of suicides, the cases of mental, are they going down, so that we can know whether the activity bared the fruit or did not? So those are some of the few expectation or aims that we were having when developing the mental health activism and talk.
And the online let's say online activism, the online part.
Yeah.
People are really sharing on WhatsApp, Facebook, everything.
Yes.
And how sure were you people that these things being shared are reaching the desired audience, the victims, rather let's just call them victims, the people who are having these issues? Like, how sure were you people? Because maybe someone just posts something and like as when you view someone's status and there's so many information, you just pass. Like there's not that, let's say, the consistency thing on the status issue. So how sure?
I understand you. You know, sometimes some people may just share because others are sharing.
Yeah, it's been shared.
Yeah,
so
but
let's share.
our aim was during that online, the first week, we were majorly doing it online. So that is where now we highlighted some of the issues together with the symptoms, so that when a person just read through or scan through the document that was sent, or maybe the advertisement, he or she may know that these are the issues that are being addressed. Maybe one or two I'm suffering from one or two issues. Like the ones that I was actually sharing, people were coming inbox telling me, I'm going through this one or these two issues. How will you help me address them? So actually, according to us, we thought actually we managed to reach the intended audience. Yeah.
Oh, thank you. We've gotten so much information, and we just love having such kind of conversation, so that my audience may get to know what they ought to do in such circumstances. So thank you for your time. And what do you have for my audience before we wrap up?
Thank you very much. What I have for people, number one, the information that I'm leaving you with, be a kind of a person that actually shares his or her own issues, so that your issues will be addressed. When you tend to keep your issues, you will accumulate these problems, and once you accumulate these problems, you'll reach a point you see no importance in life, you take your life away. So be kind of a person who share his or own issues with your friends, relatives, or your close confidant. Then number 2, don't just rest there. Sometimes toka kidogo, enda fanya exercise field, you ensure that you are fit. Then avoid being lonely. Then above all, just to remind you, you have your spiritual beliefs. That spiritual conscience in you matters a lot. Yeah, because as Christians, we believe that Christ gives us peace that surpasses human understanding. The other religions also have the way they believe in peace. Then for those who may be in need to reach out to me, you can access me within the Kabarak premises. You can ask, who is Omondi Derrick? You can check me through media. The name is just Omondi Derrick, but I've saved it, Dr. Omondi Derrick. Yeah, so thank you very much, and be blessed. Have a nice weekend, and a nice week ahead. Thank you.
Thank you guys for staying tuned. Speak out. Bye.